Hi, my name is Nick Simpson, and I'm the EMS Fellow at Hennepin County Medical Center. Today we're going to talk about trauma centers and the level of care and what that actually means. So, as many of us know, with respect to resources in the setting of trauma, this sign does not always mean the same thing. So we're going to talk about the different levels of trauma centers in Minnesota, what that means, and how it impacts our patients. The three main things I'd like to talk about today are: one, the certifying body, who does that; additionally, the different levels of care; and then finally, does that actually matter to our patients? So the American College of Surgeons is typically the accrediting body for the various levels of trauma center throughout the country. However, not each state requires this, but in Minnesota, the trauma centers are accredited by the American College of Surgeons. So the different levels of trauma center. A level 4 trauma center. This is meant for the initial stabilization and evaluation of critical patients. This can also accept lesser levels of trauma. However, for this, there are no requirements of any surgeons to present within a given time frame for this. This is not a definitive place for care for our significant trauma patients. And most of these, if not all of these, do have pre-existing transfer agreements with higher levels of care facilities. So in a level 4 facility, they should have a physician, which covers the emergency department at all times, to help direct the initial resuscitation efforts. From a level 4, we're going to go up to a level 3, level 2, and a level 1, each level building on the prior. A level 3 trauma center. This is also meant for the initial stabilization and evaluation of critical patients. These do have the requirement that a general surgeon be able to present within the trauma bay in 30 minutes. This may or may not translate to a staff surgeon on site. They may have to come from home, but they are required to be there within 30 minutes. Additionally, there are orthopedics who are on call 24/7. Also, internal medicine physicians are available should these patients need complex medical care on admission. And anesthesiology or an airway specialist, which can be filled by the emergency physician, should be able to manage any airways that come into the facility. These also have a pre-existing transfer agreement with higher levels of care. So for more of a visual, level 3 has the physician in the emergency department. In this case, should be an emergency physician. To the bottom right of your screen, you can see a depiction of an internal medicine doctor, played by Dr. House. To the bottom left, it represents the general surgeon, and then above him is the orthopedist. A level 2 trauma center. These are for essentially the definitive care. These do have a full complement of all the specialties which would be needed for a significant or major trauma patient. These do up the surgeon requirements to within 15 minutes, which typically means that a surgeon is on site and ready. They also have orthopedics, neurosurgery, radiology, internal medicine, oromaxillofacial surgery, ENT, critical care, and anesthesia, all available 24/7. These also typically work closely with a level 1 trauma center, and we'll talk about why that is in just a second. So these have much higher level care than the 3s or the 4s. As a more graphic depiction, you can see kind of working from the top, you have the OMFS, or the kind of the dental major surgery as a fractured jaw, and then going around you can see the various other specialties depicted by characters or images. And lastly, the level 1 trauma center. This has the full complement of specialties available just as the level 2. However, this adds a research and education component. To be a level 1 trauma center, you not only have to fulfill all the requirements of a level 2, you also have to do one of the 3. Either admit 1,200 trauma patients a year, have 240 admission with an injury severity score of greater than 15, or 35 patients with an injury severity score greater than 15 for all the trauma panel surgeons. Additionally, these do require a trauma surgeon within the room in 15 minutes, and they also add a multidisciplinary review and QA process. This is a much more comprehensive and, in some ways, community-focused trauma center. Again, this has everything to level 2, and in the upper left of the screen you can see the QA panel, and in the bottom right you can see the education. These are almost uniformly associated with medical residencies and training programs. And lastly, does it matter? So this is a paper that was in the New England Journal of Medicine. This is a comparison of level 1 trauma centers and non-trauma centers. And we'll go into some of the brief details, but in short, this has a very serious and real impact on the outcomes of our patients and can oftentimes mean the difference between life and death. So this is a study that had 18 level 1 trauma centers and 51 non-trauma center hospitals. They compared the outcomes of over 5,000 patients between the various centers. And of all the patients, about 1,100 died in the hospital between the sites. And to go through their results, to kind of cut to the chase, you can see that there is a statistically significant difference between the survival between the level 1 trauma center and the non-trauma center. And so while this does not compare the various levels of trauma center, what this does show us is that the trauma centers and the trauma network has a significant and real impact on our patients' outcomes. These can affect mortality, and in appropriate cases, going to a level 1 trauma center can certainly mean the difference between life and death. And so in the next section, we'll talk about how to decide where to send patients.